Welcome. My name is Corinne Waldo. I'm the Senior Director of Economic Vitality at the Boulder Chamber. I want to thank you for joining us for the February 10th cross-industry session. We are joined today by Lane Drager with Boulder County Public Health, with Tessa being out this week. I first off want to thank all of you that sent me comments based on my email yesterday to the 5 questions I posed to you. We did do these 5 questions last week during the session, specifically around, are you comfortable with the potential? Are you comfortable? Do you have any concerns about releasing the mask mandate? When would you like to see the mask mandate sunset in our community? What are the key messages? What are some metrics? And what are your thoughts about continuing the vaccine verification program, even if the mask mandate were to sunset? Thank you for submitting. I got hundreds of responses, and Lane can attest. I've already put all of those together into a feedback document that has been received by Boulder County Public Health. I will continue to take that feedback, and I will continue to put it together. And I will do one last submission on tomorrow at noon. So if you haven't had a chance to get back to me, please do so. I know that some of the other chambers sent it out, as well as Downtown Boulder Partnership, or just through my email. Please just continue to submit it. But I'm gonna have to cut that off at 10 o'clock tomorrow so that I can get the last submission to Boulder County Public Health. Again, thank you. The Board of Health meeting, and Lane will go through this. I did send out a link to the Board of Health meeting information. That is February 14th, and it starts at 5:30. If you want to attend and watch it live, it will be our Valentine's date together as a community. So just going to start with that. And then I'm going to hand it over to Lane Drager with Boulder County Public Health at this point. He's going to go through the metrics. He's going to go through the numbers. He's not going to be able to tell you what the board's going to say on Monday, but he does know that we've been soliciting this input coming in. So Lane, take it away. You've done this so many times that even if some of this stuff, even if I surprised you today, this should be pretty easy for you at this point.
We'll see. Thank you, though, and thank you for joining. So this is data that was pulled on the 8th, so it likely is a little bit different than what's displayed today, but give you the update on where things are going. And again, overall, seeing that decline really across the entire state metro area. We're still in high transmission, but again, the trends have been really declining across the board. So hospitalizations also are beginning to decrease, which is really important. That's one of the most important pieces around what we're watching. We've seen that with the change in variant from Delta to Omicron, we're seeing again a lot more disease, but a lot less severity. So that severe disease is a more important tracker than the overall case numbers. Deaths, though, continue to rise, and those are both kind of lagging metrics versus the case numbers. As you would expect, people get sick. The longer they're sick or the more severe illness, then they eventually get hospitalized, and unfortunately some succumb to the disease. So those metrics are often lagging behind the other indicators. Positivity also has been decreasing, which is great. We as a state had some just remarkably high positivity there in January, and now it's great to see that trend really coming down dramatically. Overall vaccinations, over 300 people, almost 92% of the county have at least a partial course. So that is fantastic to really see so much of our community at least fully vaxxed or have started that process. So one of the big sort of pieces of information that is important for folks to know, there are therapies out there, but there is a significant shortage, and that continues. It's really both supply chain and access issues. So I know a lot of folks have said, why are we even worrying about this anymore? There's all these things that are there to treat people who get sick. And that's really not the case. So that we're finding that a lot of people there's a lack of access to those various therapies that are out there. We also know that the state has a significant backlog in data. So while we're presenting all these trends and what we know, that we also know that the state has a significant backlog. So we don't expect that it will dramatically turn around everything, but we know that there's a lot of data that we're still waiting to we still really strongly urge folks to take those precautions. You know, if you haven't gotten fully vaccinated, or if you're really due for a booster, really do that. Definitely still wear masks. I know that's going to be a big topic at the Board of Health meeting. Appreciate the input. That's all been compiled and shared so that the board will get that information. I don't know, again, what decision they'll make, but you know, the trend obviously is to see the orders are sunsetting, but we are still in high transmission right now. So even if that order goes away, we really will still be encouraging folks to wear masks. I know many businesses have made the effort to have vaccinated facilities. Those are still great efforts. So all those strategies are still important to diminish risk. And again, we're always on the lookout for another variant that might influence what's happening. So here's again a look at that wonderful downward trend, and that's what we want to see. You can see that spike was just off the charts. So while we've dropped so dramatically, we are still way above where we were kind of when we were having problems earlier. So we still want to see that drop significantly. But again, wonderful trend to see that the case counts have dropped so much. Still, as I mentioned, high transmission really throughout Colorado. Those blue areas are just ones that don't report. So, but you can see those trends are incredibly favorable, that it's dropping really across the state. So, which again, good to see. As you would expect, since our cases are dropping, the trend across the various age groups is all dropping too. So that's all encouraging. We don't see any demographics that are trending in the opposite direction. So it's good to see all of our age demographics are trending down. Our testing, as I mentioned, positivity, it's great to see that coming down, but you can still see it is dramatically above where we were and where we want to be. So so we want to still see that drop a lot. We're at about 13%. We were at 16% last week. So great to see that. But as you remember, back when we were in a really good space in 2021, we were down, you know, less than a few percent. So so that's where we'd really like to see things get back to. Hospitalizations, again, this is probably our most important metric. The overall 7-day average of those confirmed patients has decreased by 24%. So that's great, wonderful to see that. ICU bed availability is averaging around 9%. That's kind of unchanged. So that number still is something we'd like to see improve, as well as the medical surge bed availability at 7%. That is better than it was at 6% last week, but still would love to see more capacity there so that the hospitals are not as strained. I think that I saw a lot of data that I don't have in slides here, but the issue around the healthcare workforce, which we've talked about throughout the pandemic, the number of people leaving that occupation is dramatic. So it's great to see these trends improve, but it hasn't improved fast enough for people to be willing to still stick it out and think about doing it into the future. So we really need to see that those trends change, as well as some rejuvenation within that workforce, which has been so strained. And you can see the 7-day pediatric confirmed cases has decreased. So that's good. Here's the hospitalizations for Boulder County. So 49 people hospitalized with confirmed COVID-19, and 15 of our staffed ICU beds are available. So that's improved, but again, still like to see that increase a little bit more too. Our overall health system responses, we are looking at the combined hospital transfer center plan has been lowered to tier 2. So as you may recall, in past months, we talked about the healthcare system being in sort of crisis, and it had crisis standards of care, various tiers. So it's good to see that they're starting to move out of that crisis standards and high acuity needs, so that they're able to have better availability to treat people that they're seeing. That's been a significant issue. We've heard all sorts of stories about patients being in hallways and discharged much earlier than expected, and people not even being admitted if they weren't severe enough. So all that sort of stuff, starting to see that better, as well as the ambulance and the care of where people are going, and the need to transfer people to hospitals that were beyond capacity. That is improving. So that is all really good news, but it still needs to again get a little bit better. The flu hospitalizations remain low, so that's wonderful that we aren't having the competing issues. Again, that's likely the diligence of folks being immunized, taking the same precautions of social distancing, staying home when you're sick, wearing masks. But it's good that we're not seeing a severe flu season, as we really can't afford to have that on top of COVID. There are access, for folks that are interested in tracking that. A lot of people have conjecture flu is worse than COVID, and that has definitely not borne out in the last several years. That COVID has definitely been the dominant respiratory disease of concern. Here's kind of our death information. This is always sobering to see this, and just to highlight for folks the difference in the color on the graphs. The darker color are folks that are not part of long-term care facilities. So you can see in our different waves in the previous years, a lot of those cases and the deaths came from long-term care facilities, and that has definitely not been the case throughout the Delta and Omicron waves. Is the deaths are not associated with long-term care facilities. Definitely still older age demographics, that's definitely been consistent, but it isn't long-term care facilities, which is also good news for those facilities that they have done extensive work on their protocols and precautions. Here's our vaccination numbers. As far as for fully vaccinated folks, the middle number, we're just over 70% of our residents are immunized with a full course of the COVID-19 vaccine. So that's great. And then you can see, we talked about earlier that 91.9 of our total population that have received at least one COVID-19 dose, which is great. And then the eligible population, obviously taking out the kiddos that are still not eligible, that jumps those numbers up a little bit. But again, great to see that. And it's also likely why Boulder County's numbers have always continued to trend more favorable. Just some info on the booster doses and what age demographics we're seeing. Obviously, the highest uptake is in the older age demographics, and then starting to see more in some of those younger now that they've been eligible long enough, and this pandemic has stretched on, unfortunately, so long. And as always, we have a whole bunch of resources to really get people who want the up-to-date daily information. Please feel free to access all that information on our website as well as the state's website, what's going on. Just to continue to promote vaccine clinics for those that either need boosters or if folks haven't been vaccinated and are making that decision, you can go to the Fairgrounds Clinic for a drive-through clinic. That's a good access point for folks beyond all the healthcare providers that are providing vaccines in the community. This is a little bit small, and I don't know that you need all this data, more info on the fairgrounds itself. The other, I think, important piece, there's been a lot of partners out there, that the federal government has pushed out K95 masks for folks, N95. So there's different providers who you can access to get those free masks. And again, I know that the mask orders are starting to be lifted throughout the metro area, but we are still in high transmission. And so those folks that are still, going to make those decisions want to make sure people have access to these supplies. Wish this would have been available a year plus ago, but we finally have them. And again, we're not sure what other additional variants might come our way. So please feel free to access and get yourself those higher quality masks.
Can I interrupt real quick and say that there's also, besides these two, and I've sent this out in the emails, we were able to secure masks in the city of Boulder for small businesses. I was city of Boulder funded, but I think close to 120,000 surgical masks to hand out to businesses. We've handed out 80,000 up to this point, and I still have some left. So if you're in the city of Boulder, you can contact me and I can arrange for you to pick up surgical masks. And then Boulder County Public Health for the areas affected by the fire, Superior and Louisville, was able to distribute some K95 masks to those areas for businesses and those. And you can contact the chambers in Louisville and Superior to see if they still have some K95 masks available. So those are some additional efforts we've done locally. And I want to thank all our partners who took us seriously when we say businesses are going through masks like water, and especially during the winter months and when we had this mask mandate. So knowing that it's still in place, you have people coming without masks, just let me know if you're in one of those municipalities and would like to seek some of those masks for businesses.
And applaud you for those efforts, Corinne, as you've had so many efforts to support folks in the community. I think with that, we can move to questions. So.
All right, so I just want you to clarify the difference between the orders in some of our other communities and the one in Boulder County, and why there needs to be a Board of Health meeting for the Boulder County one, as opposed to in Denver and Tri-County where it just sunsetted, didn't need a Board of Health meeting in order for it to sunset. Can you just clarify the difference between those two orders so that we can clear up some of the questions that are coming in?
Yeah, it was really a matter of how they structured them. They just picked an end date when they created those orders, and then when it came time for that, they did not pursue renewing them. So versus looking at the metrics to sunset them, which is what we had done. That being said, we've had a change in variant since the order was put in place. So I think that will be a big driver for the board to consider, that the overall case counts as the metric versus hospitalization and hospital capacity. They were tracking a little bit better under Delta, and now with Omicron, we see dramatic increase in cases, but still seeing severe impacts to the hospitals. But that 50 metric is a much different number for Omicron than it was for Delta. So so that's going to be the discussion, is really based on the epidemiological data and the change in the variant that we're dealing with, what should be the metric, and are we at a place to look at removing this, or do we need to hold it for a little bit longer, in addition to working with the school districts and all the other partners, and then obviously sharing all the input that's been gathered by the business community. So that's all going to get shared so that they can see that. And obviously the strain of neighboring counties not having orders anymore is significant, and that was an issue early on when Boulder County had the order before the other counties, and so that's obviously a piece of the puzzle too.
So just to clarify, Boulder County didn't extend their mask order. They're just having to live with the mask order that's currently in place and find whether or not they have to change the metrics. They actually have to take action in a public meeting on the order, as opposed to some of these other counties that just let it go. And that right now we've verified that they will be discussing the masks on February 14th at the meeting, the Board of Health meeting on that date, correct?
Yeah, it is on the Board of Health agenda for Monday.
And I've seen it on social media. I did put the link in the chat to the Board of Health page. You can sign up for open comment period. Again, we understand it's 5:30 on Valentine's Day evening. Some of you work in restaurants and this is a tough time. This is one of the reasons we solicited input beforehand, because we know that the 350 responses may not all be able to go to a Board of Health meeting. All right, I think we answered that question. Is there a way to list if a particular business or others are hosting a booster clinic on site somewhere?
I don't know if we've been a portal to advertise for people doing that, but certainly would encourage people to promote if there's private events that are being organized and hosted. But I don't know if our vaccine team has been sort of gathering information about booster efforts within sort of the private sector.
I've done that in the past. It was one of the efforts early on when a business and a particular business park was going to have too much vaccine. And so I promoted to other businesses in the area. This particular person that asked this question, I know, is in Lafayette. And if you want to send me the information, maybe in my next update, I could send it out maybe to help other Lafayette businesses know that that's happening at that location, just within this group. If that's something I'm willing to offer, and we can also say the same thing for some of the others.
Yeah, we can also try to link that with, the respective peers that Corinne has, which is probably what you do anyway. And get
Yeah, I'll send it to the Lafayette Chamber, and I'll send it to the Northwest Chamber Alliance group and some of the ED partners. Any extra information or clinics we can send out, that's great, because we've learned that sometimes it's about access and availability and not being able to go to the fairgrounds, or waiting the 2 weeks to go to Walgreens and then being called and told it had to be rescheduled. So anything we can share is great stuff. At this point, any more questions? I think people were really wanting to hear, I think, verification that their feedback went to Boulder County Public Health. So I appreciate you verifying that. I think I've sent about 20 notes to the senior leadership there with updated information and updated survey results. We also did get information back on whether people want to continue and participate in the vaccine verification program. I know you can't tell what the final decision would be, but that is currently being discussed on what the future of the vaccine verification program will look like if and when the mask order sunsets or is removed.
Yeah, and whether we maintain a program or, again, folks still want to do that, because it has the potential to live on beyond us having mask orders. Obviously, these are policies that businesses have already put in place. So, we certainly would encourage you to continue those. That was, I think, one of the goals of the program, is for folks to look more at their health and wellness policies and to be able to manage things at that facility level.
And it may be more about communication and support for those businesses that wish to continue the vaccine verification program, and the fact that while you don't have to be, a formal application to require vaccines, because it wouldn't require a mask, you're not asking to get your masks removed, you can still have a vaccine only, yoga class for those people that feel safer, because support in the community is not 100% around removing masks, even among the business community. And I will say that based on seeing all these survey responses, it's not 100%. There are still people that are fearful and would like to know they're in a safer environment. And yes, everybody can wear a mask if they wish, and so forth. All right. So the big deal was, we showed you the numbers. They're trending in the right direction. Thank you, Lane, for continuing to show that. Hospital, numbers are showing a little better. Unfortunately, deaths are up, but you explained that that's that lag. And then again, if you haven't submitted feedback to me, please do it by 10 o'clock tomorrow, so I can submit the final report to Boulder County Public Health about your feelings around those 5 questions. Is anything? And I can repeat those questions, or you can look in the email. And I know some of the local chambers and partners have sent those out as well. Oh. All right, so this is around, there is a question around the scientific proof and reports that show that masks work, and that lives have been saved due to masks. Again, you're not an epidemiologist. I'm not going to put you on the spot on that, but that's something that we can look back at some of the reports we've sent out before and share if they're available. And we will bring that back to the team to get that information. Unless you want to answer that, Lane.
I don't know of a quantification, that piece of how many lives have been saved. That'll be an interesting retrospective on all the different strategies and what's prevented. That's always one of the most challenging things, is how do you show all the things that didn't happen and what the exact cause and relationship is for that. As far as efficacy, there's a lot of data out through the CDC, NIOSH, and those places. So we certainly know that the respirators are your best bet for both protecting you and protecting people from you. So so there's a ton of data out there on that.
All right, and one more time, I got one last question. They showed up late. Is Boulder County Public Health leaning a certain way for the mask order. And again, the meeting will be Monday night at 5:30.
Yeah, I don't have any insight on the direction the board's going to take. So I don't really know. I will find out as all of you find out.
So certainly there's an overload of data at this point in time, but is there tracking up for breakthrough cases within the county, or is the tracking more regional?
Yeah, I had asked those questions months ago, and I think there is statewide information on that. So the CDPHE website has that vaccine breakthrough information, so you can kind of see, the risks for those that are unvaccinated. And I've seen some other wider data on people that are vaccinated but not boosted. So there's varying degrees, and it all trends. So the highest risk is by far for those that are unvaccinated, and they are still the majority of hospitalizations and deaths. And the percentage, I can't remember the multiplier, what it currently is, but the CDPHE site has that.
And last week, Tessa did present that. Your whole screen showing, by the way. So if you have anything on there that you don't want us to see, just letting you know. So last week, Tessa did present that chart that showed the increase in hospitalizations. Yes, the breakthrough numbers, as well as the increase in hospitalizations and the increase in deaths. And there is a magnitude difference. So if you want to, I can pull that chart and potentially send that out this week with it.
I got it.
Here's a question. How will the information be communicated if the mask mandate isn't lifted after the Board of Health meeting?
There'll be a press release. I'm sure Corinne will have it in her distribution network. So all of you that are here, you will definitely get it. For those that don't attend these or don't pay attention to the great information Corinne's been sharing, it'll be press releases. All the other chambers will get this information as well. So we're going to make sure information is out there. So it'll be the same sort of channels that we've used throughout the pandemic.
And to explain those channels, so I've kind of served as PIO among the chambers. So I will send out the information, and then it will go out through the chambers. They literally copy a lot of the stuff that I've sent out and send it out through their newsletters. But I will send it to this group. I do plan to attend the Board of Health meeting, and often I don't get in trouble for it, but I often get my stuff out a little bit before the press release because I don't have to go through some of the channels that the press releases have to go through. So I will try to get you information as quickly as possible. Like I said, my date is with you on Valentine's Day. I will, take care of my partner and children at another time, just so that we can communicate this information, because I know it's front of mind for the thousands of people that are on my list. So, and then all the chambers are waiting for that information as well as some of our other partners. That's the communication network we've been using since March of 2020. It's been almost 2 years, Lane.
Yeah, it's been crazy. And it just shows, I think, for those who haven't appreciated the dedication and service that Corinne has provided, the fact that she is here again on a holiday that she could be doing something more fun and romantic. She's going to be trying to get the most up-to-date information to blast it out to everybody. And so hope everybody knows and appreciates the amount of work that Corinne has put in over these 2 years.
Thank you, Lane. All right, I don't see any more questions. Thank you, Sarah. I don't see any more questions, but I will tell you I will send out information as soon as we know it. We will continue to send out emails, and then if we need another session in 2 weeks, it will be with Tessa. But hopefully, things start to settle down. Hopefully things start to be a little bit more cohesive in the area. And I will email the link to the meeting on the 14th. I did put it in the chat, and I will put it out again. I emailed it in the last email that I sent. It was also at the very top of the email is the Board of Health. You can also search Boulder County Public Health Board of Health, and it's literally the first link that comes up on Google. So here's that. All right, well, have a wonderful day. Thanks, Lane, for jumping on so quickly.
Sure.
And we will see everybody in the future. Hopefully we can stop these at some point.
Thanks so much.
Oh, and thank you, Lane, for putting in the chat. Thank you to the downtown Boulder community for recognizing recognizing this work over the last couple of years. Thank you.